When we looked at the COVID fund, we didn't think it was appropriate to spend that money on things that the government would naturally have to spend on. Things like medication, equipment, because we have to do that anyway. And so we looked for what was the most effective use of the people's money in improving the service that we give to the people for the whole of the community to benefit from. And so we looked at a number of different projects, and the one that stuck out by far was the idea of having one entrance to both St. Bernard's and the primary care centre, bringing it forward to the current line that is there, which will give us more space, doing the mezzanine level so that it's not just about aesthetics and entrances and people flow, it's also about providing a mezzanine level with administration space. And by doing it, what we get back is a huge area for waiting, for both PCC and the hospital, which means all the areas around the hospital which are currently used for waiting, for patients to wait for different areas of the hospital they want to see, will be done centrally. So it releases areas around the hospital for the benefit of clinics and for the benefit of space for clinical purposes. So the service we give will get better, the experience for the patients will be an awful lot better, and I think everyone will win. And so that was a capital project that we wouldn't have been able to do otherwise, and so we're making maximum use of the people's money and delivering a much better service to all of our community.
It must have been a difficult decision because the way that you've explained it, but I'm sure there are a lot of people, when giving that money to the COVID fund, actually thought that it would be used for enhanced medical supplies, equipment. For example, if you just opened the MRI scan, perhaps have had that in the hospital instead of in a private clinic.
I think that that's obviously been weighed up, and equipment and use of that money for run-of-the-mill clinical services that we provide and we have to pay anyway, we didn't think it was right to put that money into the consolidated fund and to spend it in the course of the GHA's annual budget. We thought it was better to preserve it, keep it apart, not touch it, and come with a project or two which would make best bang for the buck and deliver best value for money to the taxpayer. I think the MRI scanner 5 minutes away is an incredible opportunity for us, and it's costing us less than it did in Spain, and it's a very, very short trip away. So I think that's a heck of an advance for very little capital cost.
It is at this stage a consultation. So how much are the plans actually set in stone? How willing are you to change them?
Well, we've already listened, even before we did this, because people were saying that the seating for senior citizens could be improved, and that's one of the things we've adopted into the plans. The purpose of consulting is we're asking the people whose money we're spending what they think of the plans that we have. And so, of course, the only reason for doing that is to look and listen. There may be better ways of doing things than we proposed, and obviously, if we can, we will move and improve them in whatever way we can. But of course, the cost is linked also. If we suddenly get lots of ideas to do very, very much more, they may not be affordable from the COVID fund, and that's what we're trying to do. We're trying to meet the cost with the COVID fund, and obviously I can't say what that is yet because we've had a preliminary costing on it, but we need to now go into the detail of it. So we're waiting for the end of the consultation to then be able to do a full costing once we've agreed on what the final look and feel of the place is going to be.
You've got about £2.8 million in that fund. Do you think it will cover the project?
I think it will. We're also looking at other means of raising money if more is needed. We've got that beautiful area on the outside which is currently not being used, which will be a garden area for use of patients and families. We're looking at the possibility of putting a cafeteria there. The rent for that could fund a small loan to fund parts of it. So we're looking at not using government funds to be able to deliver that project in whole.
You're offering an enhanced space, is what you've said, but perhaps of more interest to the public is that you're actually enhancing the services with things such as digital check-in.
Yeah, one of the key things is when you go to the PCC or St. Bernard's, the whole entrance experience is not what we would like it to be. And so the purpose of digital check-ins is whether you're going to the PCC or St. Bernard's, because that's going to be the waiting area for the entirety of the hospital, they need to know you're there. So the digital check-in will make it much more efficient for us than going in to see somebody at a reception and saying, I'm here. They have to call or message up and they wait. The digital checking-in system will simply be somebody coming in, giving their name and their GHA card, what they're there for, and then that notification will go to that department, and they'll know they're waiting, and then they'll bring them up as and when they're ready for them. So it's going to make it more efficient, it's going to simplify it, and hopefully it'll mean that the patient experience and the flow of people through the hospital will be greatly improved.